Buenos días, hoy 1 de agosto damos inicio con con la materia de Introducción a las Ciencias de la Salud, nuestra última clase, así que vamos a pasar a nuestro último módulo, el cual corresponde a alimentación, actividad física y vida saludable. Esperando que se conecten algunos, ya voy a dar inicio con un video para que mientras empiecen a entrar al Zoom, ya vayan viendo este video para después en el segundo enlace que les haga empieza a llamar a la lista y damos inicio con las clases virtuales con la parte de la exposición que les voy a hacer por medio de las diapositivas. Entonces les comparto pantalla para que empecemos viendo el video.
Buenas tardes. Bueno, vamos a dar comienzo a la sesión conjunta entre la World Health Federation y la Sociedad Argentina de Cardiología, titulada Hacia una vida saludable. La pregunta es si estamos avanzando. Y tenemos hoy el privilegio de que nos acompañe como disertante y como coordinador el doctor David Wood, que es el presidente de la World Health Federation. También es un honor para mí presentarlo como coordinador al doctor Jorge Tartaglione, presidente de la Fundación Cardiológica Argentina. Bueno, yo me presento, el doctor Ricardo Piñera, presidente de la Sociedad Argentina de Cardiología. Entonces, vamos a comenzar con la primera disertación a cargo del doctor David Wood, que se va a referir a la estrategia global de alimentación, actividad física y vida saludable de acuerdo a la World Health Federation.
Thank you very much, and I very much welcome this opportunity for a joint session between the World Heart Federation and the Argentinian Society of Cardiology, and I am going to begin with a description of our strategy in relation to diet and physical activity and healthy living, focused on a recent white paper that we published and released at the UN high-level meeting in New York this September. Now, for those who don't know the work of the World Heart Federation, we are a federation of continental national societies of cardiology. The Inter-American Society of Cardiology, the Argentinian Society of Cardiology, for example. But equally importantly, half of our constituency comes from continental and national heart foundations, like the Inter-American Heart Foundation and the Heart Foundation in Argentina. So we embrace both the profession of cardiology, but also the patient voice through the heart foundations. And our role is global advocacy for cardiovascular health to WHO and other UN agencies. So we have a role in political advocacy, and our target is 25 by 25. The original WHO target set in 2011 at the first UN high-level meeting on non-communicable diseases. And that target is a 25% reduction in premature mortality from non-communicable diseases by the year 2025. And that target has been superseded by the Sustainable Development Goal of 30 by 30. Now, a 30% reduction in premature mortality from non-communicable diseases by 2030. And premature is defined as under the age of 70 years. And if these targets are to be achieved, they can only be achieved through a substantial reduction in mortality from cardiovascular disease, which is the commonest of the non-communicable diseases. Now, the third UN high-level meeting on non-communicable diseases took place in New York on the 27th of September this year. The theme was Time to Deliver. And you see here pictured on the right Dr. Tedros, the new Director General of WHO appointed last year, shaking the hands of the new WHO Ambassador for non-communicable diseases, Michael Bloomberg. And in the bottom right-hand corner of the screen, you may be able to see a picture of the assembly itself. And Dr. Tedros asked everybody in the room to stand up if they suffered from a non-communicable disease themselves or a member of their family or close friends, and virtually everybody stood up in the room, illustrating poignantly the burden of non-communicable diseases worldwide, which is the commonest cause of death. We announced, as the World Heart Federation, on behalf of our Global Coalition for Circulatory Health, our new white paper, Driving Sustainable Action for Circulatory Health. Here is the EU Commissioner for Health and Food Safety making the public announcement. And this white paper is available on the World Heart Federation website. What is the Global Coalition for Circulatory Health? It is all of the international organizations like the World Heart Federation, which are in official relations with WHO and have some stake in circulatory health. And we have a leadership group comprised of the following organizations. And you can see by looking down this list that we embrace not just specialists working in hospitals, but also family doctors, nurses, patient organizations, and finally, public health associations. In other words, the complete spectrum of international organizations concerned with circulatory health. And in the white paper, we have defined 4 priority areas on which we invite the Global Coalition for Circulatory Health to take action. And I want to address each of these 4 areas in turn. The first is prioritizing multicentral and cost-effective interventions. And we have chosen the following interventions as the best buys for reducing the burden of cardiovascular disease. The first is the Framework Convention on Tobacco Control and its implementation. This convention has led to the public ban on smoking in public places. It has led to taxation on cigarettes and related tobacco products with a corresponding reduction in their use. It has led to graphic representations on cigarette packets of the consequences of smoking, and most recently to plain packaging led by the Australian government. This single convention, which has the signatories of the majority of countries in the world, is really addressing the burden of tobacco use and seeking its reduction. Tobacco is the single most important cause of cardiovascular disease, and so this is our top priority. A second priority is obesity. We have a growing tide of obesity in the world, particularly in children and young people, and in the wake of obesity we have diabetes following, with all of its attendant risks in terms of microvascular and macrovascular disease. And so we have prioritized the WHO Ending Childhood Obesity Report as a framework for action by the global coalition. And thirdly, and finally, reformulation of foods to reduce sodium and eliminate trans fatty acids. And trans fatty acids are completely artificial. They increase the risk of developing cardiovascular disease. The Danish government banned the use of trans fatty acids in all foods in their country many years ago, and WHO has now adopted this policy as well to eliminate trans fatty acids from all food production. The second priority is fostering access to prevention and care of circulatory diseases. And beyond addressing lifestyle through tobacco control and obesity, through diet and physical activity, we need to ensure access to affordable, quality-assured, essential medicines. And the list of medicines that you see here are all on the WHO Essential Medicines list, and they are required for both secondary and primary prevention of cardiovascular disease. But if you look at epidemiological data, and these come from the PURE study, for patients with coronary disease on the left and for patients with stroke on the right, and moving from left to right, you have the use of these drugs in high income, upper middle income, lower middle income, and low income countries, and the grey bars represent no drug therapy prescribed whatsoever for patients with coronary disease or stroke. And overall, around the world, about half of all patients with coronary disease are receiving no drug therapies whatsoever, and similarly for stroke. But as you can see from these figures, there is enormous inequity in the availability of these essential medicines between countries at different levels of economic development, with the vast majority of patients in low-income countries receiving no drug therapies whatsoever for either coronary disease or stroke. Our third priority is mobilizing resources for circulatory health. So beyond a lifestyle intervention and the use of essential medicines, we need to be able to resource the healthcare system to deliver better prevention and control. And where do we get that money from? Well, we tax unhealthy products. We tax tobacco, we tax alcohol, unhealthy foods, sugar-sweetened non-alcoholic beverages, and so on. Taxation is a major source of revenue for governments, and that revenue can be channeled into the health service to advance prevention and control of circulatory diseases. For governments, they come up against opposition from industry, from the tobacco industry, from the food industry, and so on. But nonetheless, there is a benefit to government from raising taxes in this way, because they can plow them in to prevention and control of circulatory diseases for the benefit of their populations. And then finally, the fourth objective is measuring and tracking progress. We need reliable, simple, and fit-for-purpose surveillance systems to monitor the burden of disease, the prevalence of risk factors, and how they are being treated. If we do not have these data, we don't know whether or not we are accomplishing what we aim to accomplish in terms of prevention and control. And so we need to be able to have in place reliable, simple surveillance systems. So in summary, this white paper for circulatory health is focused on four key areas. The first relates to lifestyle, because it is lifestyle that is driving the burden of non-communicable diseases and specifically cardiovascular disease. And we need to address lifestyle and specifically tobacco, obesity, and unhealthy foods. But secondly, beyond lifestyle, And for patients who have already developed the disease or are at high risk of doing so, we need access to essential drugs to prevent and treat heart attacks and strokes, and these need to be available worldwide. Thirdly, how do we pay for this? We need to advocate for heavy taxation of unhealthy products and to channel those revenues from tax into our healthcare systems. And finally, we need to measure and monitor outcomes and hold our policymakers and politicians to account. The Global Coalition for Circulatory Health and this white paper, which is available on the World Heart Federation website, is an important step forward in working towards the goals of 25 by 25 and the Sustainable Development Goal of 30 by 30. The time has come to implement what we know, to translate science into practice, efficacy into effectiveness, and cost-effective prevention and control of cardiovascular disease. May I finish by inviting all of you to Dubai. It's a long way away, but there we are holding the next World Congress of Cardiology and Cardiovascular Health from the 5th to the 8th of December this year, and it will be preceded by our third Global Summit on Circulatory Health from December 4th to 5th, and the theme of the summit is access to essential medicines and technologies. Thank you very much.
Bueno, como vieron este video, sí, fue en inglés, pero estaba la traducción aquí abajo. ¿Por qué le pasé este video? Que para que se den cuenta que lo mismo deberíamos hacer acá en la Sociedad Boliviana de Cardiología, me refiero, cuando vemos que todos los problemas que por la mala alimentación, por la mala actividad física, por el consumo del tabaco, lo que les hablaba, por las bebidas y las comidas colicitoquinéticas, me refiero a bebidas alcohólicas, la obesidad y otras enfermedades de base, llevan a producir, ¿qué? Accidentes cerebrovasculares o infartos miocardio. Si cuidamos ambos solamente con una buena alimentación y una actividad física, ambos pueden ser prevenibles. Me refiero al infarto y a la enfermedad vascular y al infarto miocardio. Entonces, les envío el segundo enlace, chicos, y sigamos con la clase.